Guys, thanks for joining me for episode 4. My name is Dr. Cisnet, and today we're going to be heading even further north of the United States. We'll be heading to Canada. Now, those who visited Canada or those who have relatives in Canada can attest to this. Canada is a very lovely country. I visited there, I passed through there in 2017 on my way to the UK to do my MRCS examination. And as a child, I used to visit there like every two to 3 years, and it was an extremely awesome experience. The last time I visited there was 2017, and before that, it was like a 17-year hiatus. The last visit prior to that was in 2000. But it's an awesome healthcare system. It's a public healthcare system, so you have a lot of volume. Some of the issues that you will meet up in Canada, you probably won't meet up in America, and vice versa. But if you're a Canadian citizen, you're entitled to free healthcare. And it's free with inverted commas because there's some things that you might have to pay for or get subsidized. But it's an awesome healthcare system. It's one of the leading ones in the world. So here we go. The program is a 4-year program or 48-month program. It's a master's or PhD. You can do a PhD. You do rotations at Mount Sinai Hospital or Sunnybrook Health Services. Mount Sinai is well known, very, very well known. And the hospital for sick children, that is where most of the pediatric residents and most of the residents here in the Caribbean are pretty much worldwide. When they want to do fellowships, they go there to do fellowships. It's well known. Like, if you haven't heard of the hospital for sick children, please go and just Google it, because, as a medical professional and a dental professional, you need to know about these places. The residents, they have like I said, it's a 4-year program. In Canada, they don't do it like how they do it in the UK. In Canada, in UK they do ST3, ST1 to ST7. So surgical training year 1 to surgical training year 7. Here they do PGY1, which is how they do it for pretty much all residencies in medicine. So like I think it stands for postgraduate year 1. So the junior resident in year 1, you focus on patient care and outpatient clinic management, and you assist in the operating room. Now, for those who are in surgery or not in surgery, they can attest to this, that surgery is one of those things where you have to assist first to observe how your mentor gains access, how they carry the procedure, the precautions taken. And then afterwards, most times I've had good surgical consultants. Most times they'll say, well, what did you learn today? Afterwards, they ask you, how do you prevent this? Should this arise? If this complication arises, how do you manage it? I'm going to give you a perfect example. So a lot of the times in MRCS, the management of post-operative patients comes into play. There's actually a station for some exams where you have a phone and your consultant calls you and asks you, tells you that, you tell them that there's a patient on the ward. They give you a sheet and they tell you there's a patient on the ward who's having shortness of breath. So how do you manage that patient? So you would then end up saying, shortness of breath, you're going to airway, breathing, circulation. You try to make sure the patient's airway is patent, and you try to you call for help, get an ECG, arrange a CTP if you're thinking of DVT, check for calf tenderness. You check their saturations. The ECG, you check for the S1, Q1, T3. There's a particular arrangement that you see on an ECG that the medicine persons will know. I can't remember it right now, but you look on the ECG to see if you're seeing changes that would indicate a DVT, which is very unlikely on the ECG, but still. And these are the things that they like to hear. So for postgraduate year 1, you're basically managing your patients, and that's very important. Most persons want to dive right into cutting. You have to know how to pre-op patients. You have to know how to manage them post-operatively. So yes, postgraduate year 2, you do a 12-month rotation. It's off service. Year 3, you're developing your surgical skills and managing operating rooms. As I mentioned, you start small and then you move big. And by year 4, you should be managing the operating room. Most likely, you'll be under the tutelage of your attending. So during this time, you have to do ATLS. I know in the UK, you do the CRISP training program, or the care of the critically ill surgical patient. You have to do BLS in medical school and in dental school. So these are things that you have to look at. So here's one of the things that really made me get happy with this program. So if you look at the eligibility, if you read it, it actually singles out what you as an international dental graduate are supposed to do when you're applying. You have to check and see what your qualifications, how your qualifications line up with this university, if they are recognized. It tells you your GPA, the GPA that is required, B+. For those who've ever been to the University of Toronto, I've never been, but I have colleagues who've done masters, not in the medical field. They've done masters in engineering and they've done masters in finance. And the University of Toronto is actually one of those universities that loves to pull in a lot of persons from all around. So I'm not really surprised that the program accepts non-nationals. I'm pretty certain it's not easy to get in, but that's still a positive because no program for surgery is easy to get in. Sometimes people wait off 3-4 years, but if you really love surgery, you'll wait. English language proficiency. This is a must. So you have to take your TOEFL or your IELTS. And sometimes even for persons whose first language is English, you have to do the IELTS. And I had to prove that my English language proficiency was good when I applied to the GMC. I haven't finished the process yet because I was, money and everything. But even for the GMC, I had to get my university to write and state that I was training and that I was trained in a hospital that speaks English, which was quite interesting. So they have internships as well too. I'm not really interested in the internships because most time the internships you have to pay. So this is one of those universities. This is the second university that I have actually pointed out that you can actually get in as an international dental graduate, which is good. So they have fellowships in temporal mandibular joint and orthognathic surgery. Temporal mandibular joint issues are very common. I think I was reading a paper the other day that said 1/3 of the population has some issues with their TMJ. And then orthognathic surgery is for persons with like class 3 issues. They deal with a lot of other things too. If you have malformations of your jaw, and trust me, there are quite a few persons who have orthognathics or get orthognathic surgery and you would never even know. So yes, this is a good page. This is a good residency program. It's 4 years, which is perfect for me. As you know, I'm only focused on the 4-year programs. If you want a dual qualification, you might have to look at other universities. But I think Manitoba has one. I may do one on that, a 6-year program, and McGill has a program as well too. But McGill, there's a language barrier because remember it's French. So I'm going to look into those other ones too. But this page is good. You can take a look at it, University of Toronto. Okay, I hope you guys like this one.